Hi, my name is Tim Aubry. I'm a professor in the School of Psychology at the University of Ottawa. And I'm going to tell you today briefly about a study in which I've been involved with over the last number of years. It's called the At-Home Chez Soi Demonstration Project. The project is the largest study of its kind in the world that looks at a housing first approach to addressing homelessness among people with severe and persistent mental illness. It's intended to look at the effectiveness of this approach, the cost effectiveness, as well as to be able to describe its essential ingredients. Traditionally, we've used a stepped or staged approach to helping people exit homelessness. This kind of staged approach has required people to engage in treatment and to achieve a certain level of stability in terms of their functioning, as well as often requiring them to be abstinent in terms of using drugs or consuming alcohol. In contrast, the housing first approach moves people into housing right away without any preconditions. It has two main components. One is a housing component where people are provided with a rent subsidy, ensuring that they can afford the housing. They're not spending more than 30% of their income on rent. And that's combined with support that's provided in the community. The two main approaches to support that are provided in Housing First are either assertive community treatment for people who have higher levels of needs, or intensive case management for people with more moderate needs. The study involved a randomized controlled trial where people were either assigned to receive Housing First or treatment as usual in their communities. It was placed in 5 different cities across the country: Moncton, Montreal, Toronto, Winnipeg, and Vancouver. In total, there were over 2,100 people who were in the study, of which a little bit more than half, over 1,100, received Housing First, with the rest receiving treatment as usual. It involved a diverse group of participants. It was a group of people who had experienced, for the most part, lengthy periods of homelessness on average over a lifetime. It was 5 years. They all had one or more mental health issue, and a majority, about 2/3, had a concurrent disorder, so a diagnosable mental health problem combined with an addiction. In addition, a very large number had one or more chronic physical health condition. If we move right to the outcomes, what we found was that Housing First achieved housing stability in a significantly greater proportion of participants than treatment as usual. For example, at the end of the study, over 60% of the participants who received Housing First had been housed for 6 months or more, compared to about half of that for the treatment as usual participants, a little bit over 30%. As well, if we just talk about now in terms of the percentage of time that people were in housing over the course of the study, Housing First participants were housed 73% of the time as a group versus 32% for treatment as usual. This finding was consistent across the 5 cities. In addition to the housing outcomes, Housing First participants also showed greater improvements than treatment as usual participants in terms of their community functioning. which is their ability to live independently in the community and become integrated. They also reported a higher quality of life, more satisfaction with their living situation, with leisure activities that they participated in, as well as their sense of safety. Both groups reported improvements when it came to substance use and mental health functioning. We believe that this is in part the result of the treatment as usual group also receiving treatment and social services that are having some effect. If we look at costing, finally, in terms of our outcomes, what we find is that for every $10 that's invested in Housing First, there's about $7 that are saved in terms of the cost related to healthcare, social services, and justice kind of services that are used. In addition, if we look at people with the highest needs, those people who are receiving assertive community treatment, the saving is almost dollar for dollar. So for every $10 invested in Housing First, there's a saving of $10 in terms of the different kind of services that they're using. So in summary, in terms of the study, what it's shown is that it's Housing First is certainly doable in Canadian cities of different sizes and composition. It's effective in helping people rapidly exit homelessness, people who've had lengthy histories of having difficulty in staying in housing. Housing First also produces positive outcomes above and beyond regular services, notably in the areas of community functioning and quality of life. And finally, when we look at costing, it shows that Housing First makes good use of public dollars. That's a very quick summary of some of the findings coming out of the at-home Chez Soi project. We expect to release the full report on the findings early in 2014. I want to thank you today for viewing this video and finding out a little bit about the at-home Chez Soi Demonstration Project.